lab that hurt her leg running through the snow a couple weeks ago. We've tried to keep her quiet, given her NSAIDs such as Rimmondel to take the inflammation out and to help ease some of the pain. But being a 1-year-old lab, it's pretty hard to keep her quiet, and it seems as though the leg is not getting any better. So today we're going to take a trip to see her dad, Dr. Dan Kelly, the orthopedic surgeon at Stonecliff Animal Clinic in Lebanon, New Hampshire, and hopefully make some decisions on what's next for her leg. Dr. Kelly usually starts out his orthopedic exams by gathering a history, just kind of figuring out what's been going on with the dog, and having the dog move around the room a little bit so he can see, where the weaknesses are, kind of see if she's favoring one limb over another, and just kind of get an idea of the attitude of the dog in the exam room. He then performs an orthopedic exam, which involves manipulating the joints, checking for problems with the patella and laxity in the knee. Dr. Kelly diagnoses a partial tear of Lola's ACL ligament, and we discuss the different procedures that he could use to stabilize her knee, such as the TPLO, lateral suture, and the new procedure, the Ruby, that he's now performing at Stonecliff.
Completely torn, the TPLO will be overkill. And I think at this point we could do something to potentially augment what is there and prevent it from, and allowing it to heal and prevent it from completely rupturing. Because I do know in this household, owner compliance is a huge problem in terms of keeping this dog resting and allowing that to heal.
Ouch. Brutal. And so is the recovery time different for the Ruby than for the TPLO?
Much less. It's only 6 weeks of restricted activity.
Lily, you went through the TPLO with your dog?
I did, yeah, and I did try medical management first. It was a good month of Rimmondel and rest. And it was just a partial tear in the beginning, and then it ended up fully tearing because she is a boxer mix and very active. So then we did go with the TPLO because she is very, very active and a lot of jumping. So after recovery, that was a year ago, by summer, she was back to normal and no problem since.
Wow.
Yeah.
That's great. Who was your surgeon?
Dr. Kelly.
He's the best, isn't he?
Yeah.
That's what we all think. He's so good. So, okay, well, I guess I don't know.
Dr. Kelly feels since Lola's ACL is only partially torn, the Ruby would be a good procedure to try, since it would stabilize her knee and be less invasive.
This is a bone model demonstrating the Ruby. Traditionally, extra capsular techniques, which is stabilization, which is done outside of the joint. Traditionally, that's been done with what we call a lateral suture. And with a lateral suture, we would drill a hole here in the front of the tibia, and we take a suture, which is basically looks just like a monofilament fishing line, but it's very, very heavy. We run it through that hole, comes back under the patellar ligament here, and around this little bone in the back of the knee, and then it comes back. So you have a suture going from here to here. That running in that plane runs in the same plane as the anterior cruciate ligament, preventing both cranial tibial thrust, or the tibia going forward, and it prevents internal rotation of the tibia, this motion here. The weak link in that procedure, which has been done, I learned to do it in vet school back in the late 80s, is where that suture runs through the bone tunnel here. A dog like Lola is going to cycle like this thousands and thousands of times a day, and eventually it's going to wear that suture and break. And the thought is that all of those break at some point, as long as it's not for months to potentially years after that suture's been put in. You'll have a good fibrous tract of scar tissue here that serves as a pseudoligament when that suture breaks. But if they break prematurely, which is more common in the larger the dog or the more active dog, that surgery does fail. So This technique called Ruby has been developed to prevent that suture breakage. What we do is, it's called Ruby because you can see the red on the inside of that implant is a space-age ceramic material, and then this fiber comes out of there, and there's a very, very low friction point where those two interface. So they can do this all day long, and in theory, this structure should last the lifetime of the dog. So we drill holes, we screw these implants in here, we screw the implant here into the femur, and it's connected with a clip, those two filaments. This should last the life of the dog, okay? And so we're hopeful that we may get outcomes as good as TPLOs, or potentially better in some of the maybe a little bit smaller dogs, with a much less invasive and considerably less expensive and less aftercare in this procedure. There's two limitations to this procedure. One is we don't have long-term studies. These have been being put in dogs for 2 years. Vet School of Virginia Tech is doing the majority of the work on that. They've got hundreds of them in. So far they're extremely happy, and they have an extremely low failure rate. And usually that was due to technical error early in the process. But we don't know what they're going to be in 10 years. The theory is they're going to hold in 10 years. So there's a little bit of a leap of faith if you like to do this procedure, in that we don't have those long-term follow-up studies. I can tell you with a total degree of confidence it's going to hold up a whole lot better than traditional lateral suture that we've been doing. The other limitation right now is the implants that we have available are engineered up to dogs up to 60 pounds. So greater than 60-pound dogs, in theory, this is not an optimal procedure. The larger implants are in the process of being manufactured now, but we have no idea when they're going to become available. That being said, I do cheat up above that 60-pound weight limit pretty regularly, because even though that's the limit, these are way over-engineered, and I know it's going to work better even in 70, 80-pound dogs in that lateral suture. So this is still superior to that. But if we go over 60 pounds, the manufacturer probably isn't gonna stand behind it anymore, and I don't blame them, but it should be fine. I would certainly consider this in our own dog like Lola. The fact that we were considering it as a prevention to a complete rupture, that's something that maybe not everybody would agree with, but in my clinical experience with a dog like Lola and her level of activity, she will eventually completely rupture that ACL. And resting her for extended periods of time is extremely difficult and frustrating.
Do you hear that, Lola?